Here's a product that corrects knee torsion. It's the ReaLine Leg Press. ReaLine Leg Press. Through leg pressing exercise with extension and flexion motion of the knee, this training device corrects abnormal knee torsion, which is the cause of most knee problems. Oh, is that the leg press?
Yes, it is. It's called a ReaLine Leg Press. It's used to correct abnormal knee torsion.
It looks like just the ankle is being exercised. Is that right?
Actually, it is being rotated at the knee here. Using the hamstring muscles on the back of the thigh, he's rotating his shank. Through this exercise, the leg is moved in a direction that will correct the abnormal knee torsion. It is a surprisingly little known fact that most of us have knees with abnormal torsion toward the outside.
During our ordinary lives, since our childhood, our knees tend to be rotated gradually toward the outside. This device corrects our knees to their normal positions by turning them with knee rotation toward the inside.
Let's start by placing your right foot here.
Okay, I set my foot here.
And I'll fasten the belt. Now, hold the rubber band with your left hand and gently pull. At this point, we shouldn't let the knee move in this way, so let's place your knee a little to the outside.
So I leave my knees in this position.
And move your toes only. Keep in mind that you'll be rotating from your shank, not just moving the foot and ankles. When you rotate your shank, you'll be using the hamstring muscles that are on the inner back side of your thigh. For now, pulling with your left hand will help knee rotation. Beginners sometimes find it hard to do the rotation motion well, so at first this helps to perform rotation toward the inside. Now that you're somewhat used to this, switch hands and pull with your right hand. This will apply resistance against knee rotation. Generate enough rotation torque to withstand the resistance of the rubber band.
How does this movement straighten out the torsion? What is the mechanism that makes that possible?
One mechanism used is called internal rotation, which is induced by the action of the muscles on the inside. Another factor is that the muscles on the outside are stretched and loosened up little by little. This combination changes the relative rotation of the knee.
Does this mean the inner muscles aren't used during our regular daily activities?
They're used surprisingly little. For example, when women in particular sit on the floor, they often sit with their toes open to the outside. In that condition, the knees are abnormally rotated toward the outside. The only position that induces knee rotation toward the inside is in the Zen sitting position. But other than that, there is almost no such movement. Okay, I think you've gotten somewhat familiar with this. Now, with your knee rotated toward the inside, extend your knee.
Ah, this is pretty hard.
Now, extend and bend your knee while keeping your toes turned to the inside.
Not only do I work the muscles on the inner part of the thigh, I also work the back of the calf, don't I?
Yes, you do. Normally, we bend and extend our leg while the shank is rotated toward the outside. Now, we will do the opposite, with it rotated toward the inside. In other words, we'll bend and extend the leg while it is back in the correct rotation. Now, we'll learn that exercise.
The ReaLine Leg Press is used as part of a daily routine to treat and correct knee torsion and is popular among a broad range of people, ranging from athletes to older adults to children.
When a person has knee pain, it's not a good thing to perform movements that rotate the knee while standing. Naturally, such movements cause pain and anxiety. For that reason, it's better to exercise the knee with light loads and under conditions where you can clearly see the knee motion with your own eyes.
It's pretty compact for a device that corrects knee torsion, isn't it?
Yeah, it's small enough that users normally keep it under their bed or in a closet. Then, they can easily take it out, use it, and then put it back. It's really simple to use and store.
And I'm guessing that's important to use it every day, right?
That's right. The tendency of the knee to rotate is not easy to correct. Therefore, it's important to make an effort to correct this torsion little by little each day. In the past, treatment typically consisted of manual therapy, whereby a patient's malaligned joint would be corrected by hand, or muscle contractions would be stimulated. But these remedies didn't lead to much patient awareness. Thanks to the support function, patients gain more of a self-awareness of the torsion in their knees. Treatment becomes easier, and patients have a better understanding of what we are trying to tell them. In the future, I think many different people will be able to use the equipment, including people without any disorders. Also, I think that this exercise device, combined with preventative measures, will help improve the conditions of people who are concerned about disorders such as knee torsion, deformation, bow legs, and knock knees. So I strongly encourage people like that to use this device.